Hi everyone, Doc Mitch here. Now, welcome to the second video of the Vaginal Conversation series. Now, most, if not all women at one point in their lives experience vaginal itching. So, let's talk about it. Alright, excuse the fan ha, kasi hindi talaga kinakaya ng aircon ko yung heat today. But anyway, so my question is, have you ever experienced having that itch down there na hindi ka makatulog sa gabi sa sobrang kate? Or, if you're at work or outside, you have to go to the CR once in a while kasi talagang hindi mo matolerate yung itch? Okay, if your answer is yes, you probably experience vaginal candidiasis, or more commonly known as a yeast infection. Okay, before we go any further, let's get one thing straight. Lahat ng babae, kahit hindi sexually active, pwede magkaroon ng fungal infection down there. Okay, so what causes vaginal candidiasis? It's actually caused by a fungus called Candida. And this Candida is found in small amounts in the vagina. Diba sabi ko nga in the previous video, the vagina maintains a balance of different organisms, both bacteria and yeast, and this is maintained with an acidic pH of 3.8 to 4.2. Now, okay, since acidic yan, diba? So if the balance in the vagina, in the vaginal environment is changed, then actually yeast infections can happen. So what are the causes of a possible disruption in the balance in the vagina? As I've mentioned in the previous video, pwedeng intake of antibiotics. Now, the antibiotics, again, will kill the organisms that are present in the vagina, and because of this, there may be an overgrowth of the yeast or of the fungus, Candida. Next, pregnancy. Pwede rin kasi nag-change slightly ang pH ng vagina pag pregnant ka. So, nagiging mas basic ng konti. What do I mean by mas basic ng konti? A little higher than 4.2. And if you have very frequent vaginal candidiasis, it may be a sign that you have diabetes. Or diabetic patients also are more prone to actually mga fungal infections because nga there is also a slight change in the pH. Okay. When patients are immunocompromised, pwede rin actually, ano ibig sabihin ng immunocompromised? Mababa ang resistensya. Pwede rin magkaroon ng overgrowth of the yeast or of the fungal elements inside the vagina. And it can also be very severe in cases like merong HIV. Okay? Now, vaginal infections or candidal infections can actually go away, or pwede rin, despite treatment, persistent siya. So, ang importante is malaman mo kung ano ang signs ng vaginal infection. Malaman mo kung meron ka na ba nito para magamot. Kasi madali naman siyang magamot. So, how do you know if you have candidal infection? Now, the most common symptom of women who have candidal infection is itching and burning down there. The burning sensation may actually be worse during the time that you're urinating or nagwiwiwi ka at during sex. Okay, and then, yung labia mo, okay, yung vulva, okay, may be swollen and red. Kasi, sa kakakamot na rin. So, yun nga yung sinasabi ko sa mga pasyente ko na they come to me, they complain a lot, and then pagtingin ko dun sa vulva nila, pagtingin ko dun sa labia nila, mukhang guilty. Kinamot ng kinamot, kaya halos nangingitim na sa kakakamot. So, please do not do that. Do not scratch, kasi pwede mangitim ang labia natin because of the irritation ng kakascratch. I don't think you would want that, diba? Now, bukod dun sa itching and burning sensation, most women, or if not all women with vaginal candidiasis, actually have this cottage cheese-like discharge. Ito yung, diba kumain naman kayo siguro ng cottage cheese? It's white, na in clumps, tapos ano siya, sobrang makati yung mga areas na merong discharge. Pero wala siyang smell. Merong iba na maraming discharge, meron namang iba na hindi naman ganun kadami. Now, how do we know or how do we differentiate kung normal pa yung discharge mo or hindi? Kasi sasabihin ng iba, Doc, di ba normal naman yung whitish na discharge? sabi mo, cottage cheese-like. Now, abnormal discharges actually stick to the upper part of the vaginal wall. So, pag nag-examine kami na ang discharge mo nasa lower part lang, then we may actually say that it may still be a normal discharge. Pero kung may discharge na kahit sa upper vaginal wall, then that's something else. That's probably an infection already. So, what am I saying here? It's very important that you get checked and you did not self-medicate, because that's one of the worst things you can do, especially for a vaginal candidiasis, because if you treat it wrongly, then it may actually persist or it can recur over and over and over again, and I don't think you would want to have an itch once in a while down there, okay? Or you don't want to have an itch always down there. This is how the discharge looks like. Ulitin ko ha, symptoms of a yeast infection include itching, redness, burning sensation, and a whitish cottage cheese-like discharge that comes in clumps and has no smell. So how do we diagnose? Aside from clinical diagnosis, meaning yung inspection namin sa inyo during examination, we can actually take a sample of your discharge also and actually look at it under the microscope. And this is what we're going to see. So how do we treat fungal infection of the vagina? We can actually give you vaginal tablets to insert, okay, and then vaginal creams to actually apply on the areas that are very itchy. Or if you're not comfortable with vaginal preparations, then we can give you oral preparations that you can either take as a single dose or you can take actually for several days. If the infection is recurrent, we can actually give you a longer regimen. And of course, good hygiene is also very important. Try to use a feminine wash that will actually maintain the acidic pH of your vagina so as to actually restore the acidity if you have fungal infection. Okay, so it's both antifungal medications and again, good hygiene. Very, very important. So how do you prevent vaginal candidiasis? Number one is keep your skin dry down there because candida loves moisture, okay? Next, avoid wearing tight-fitting clothing very frequently because yun nga yung sabi ko dun sa previous video, skinny jeans, tight pants, kasi candidal elements like warm, moist, and dark areas. So, the tighter the clothes are, the more prone you are to fungal infections. Third, do not douche. Again, bakit? Kasi you remove all the organisms inside the vagina. So, pag tinanggal mo lahat yon, there will be a change in the pH and there might be an overgrowth of your yeast. Okay, and then fourth, if you are diabetic, please try to control the spikes of your blood sugar kasi nga, if you are diabetic, there is a chance that there might be a change in the pH in the vagina and there is an overgrowth of the yeast organism inside there, thus causing vaginal candidiasis. Tell me, Dok naman, lockdown, diba? So, paano kami magpapacheck up? So, paano kami kukuha ng mga medication? Sige, pwede din naman mag-over-the-counter ng mga antifungal medications. Pero, kung, say, for example, after the treatment, ganun pa rin ang nararamdaman or despite treatment, lalong nag-worsen actually yung situation, then it's very important that you call your doctor, your OBGYN, and then she can actually give you advice, and then hopefully she can see you once the lockdown is lifted, or the ECQ is lifted. So with that, if you like this video, give me a thumbs up, and don't forget to subscribe. Thanks for watching. God bless you all. Bye-bye. Stay safe.